Good afternoon and welcome. My name is Natalie Bright with Bright & Carpenter Consulting. I serve as the contract lobbyist in Topeka for the Shawnee Chamber, and it's my honor to be your moderator for today's forum. I'm pitch hitting for Joe Rydell, who was unable to make it. As we did in the primary election, we are hosting these forums this year in a virtual format, so please bear with us as we adjust to this method of providing you with information to assist you in making informed choices before casting your ballot in the upcoming election. On behalf of the Johnson County Public Policy Council, a collaboration of all 10 chambers of commerce, and particularly on behalf of the Shawnee Chamber, thank you for attending our forums featuring candidates from the House District 18. I'd also like to thank our sponsor for our governmental affairs program throughout the year, Evergy. The format will be the same for all of your forums and will be as follows. There's a 3-minute opening statement by the candidates, a moderated question and answer period during which each candidate will have 1.5 minutes to respond, and then a 2-minute closing statement. The format, questions, and time limits will all be the same for each candidate. And due to time constraints, there will be no follow-up questions or formal rebuttal time. Candidate speaking order has been randomly determined with the candidates, and we will rotate throughout the program. Questions have been prepared in advance by the chamber staff based on member input and have not been shared with the candidates. If we have time, we will attempt to answer any questions that might be submitted via the chat. Okay, let's get started with introducing our candidates. Let me now introduce District 18, located just completely within the Shawnee and is bounded by Schweitzer Road on the east and the county line on the north, Lackman to Johnson Drive, and then Slum Roads on the west and 71st Street on the south. Our first is our incumbent Cindy Neighbor, who represents the District 18 currently. She serves as the ranking minority member on the Insurance Committee and is a member of the Children and Seniors Committee and Energy, Utilities, and Telecommunications in the Kansas House. She has spent most of her career as a medical administrator for a multi-specialty group and worked for Discover Dental handling sedation of patients. She also has spent 9 years working for the Shawnee Mission Schools in various roles while she was raising her children. She's been married to Jim, a retired airline pilot and former Shawnee City Councilman for over 50 years. They have 4 grown children, all who have graduated from the Shawnee Mission School District, and they now have 4 grandsons. Her opponent is Cathy Gordon. She's a wife, a mother, a nurse practitioner, and a businesswoman in both the for-profit and nonprofit sector. Born in Kansas, she is from several generations of entrepreneurs. Excuse me, and is hardworking farmers and small business owners. Excuse me, is a lifelong Republican. Let's get started with our candidates with their opening statements. They'll each have 3 minutes, and Cathy, based on the coin costs, you get to go first.
Hi, I'm Cathy Gordon. It is such a pleasure to be here. Thank you, Shawnee Chamber, for hosting this, and thank you, Natalie, for jumping in. And I'd offer you my drink of water here. I'm so sorry, honey. It's such a pleasure to be here. And as part of the introduction, I am thrilled to be a part of the change makers in Kansas. I'm quite independent. I am a nurse practitioner that has started and maintained sustainable businesses in the state since the year 2000. And they continue to go. And I know that these kind of opportunities are what our state needs. My family, I grew up in the plains out by Canopolis Lake, Ellsworth County. My family was there. I learned how to do harvest. I drove the wheat trucks. I learned how to round cattle riding bareback on quarter horses. I learned the hard work that most Kansans aspire to and maintain daily in the entrepreneur world of just going to work and worrying about payroll for others and maintaining sustainable businesses. That's all about my family and myself. And I'm so thrilled to be here, a candidate for District 18. And my biggest commodity right now in this candidacy is the people, and preserving and preventing health care catastrophes like the pandemic we've faced, and teaching people to be responsible citizens through good quality healthcare initiatives. So I stand here or sit here today and in hopes and and its aspirations for our state to improve and to help be that independent role here in the State House, as well as continuing in my role in the business world. So thank you again. Thank you, Shawnee Chamber, for hosting this.
Thanks so much, Cathy. I appreciate it. And thanks for offering up your water. Apologize, those darn seasonal allergies. Yes. All right, Cindy, let's get started with Representative Cindy Neighbor. You have 3 minutes, Cindy.
Thank you, and thank you to all the sponsors of today's forum. Jim and I have lived in Shawnee for over 45 years and have seen the many positive changes and growth. We have 4 children, as you mentioned, Natalie, and 4 grandsons, all who have attended public schools. As many of you know, I am a retired medical administrator for a multi-specialty group that was in Wyandotte and Johnson County. I worked with 45 doctors and 75 staff, so my days were full. I have also been a person who has been involved in community service most of my life. I served on our local fire department as a rescue worker in my younger days. And over the last 30 years, and I spent 30 years on the Shawnee Mission Advisory Board and the Shawnee Mission School Board, working with teachers, students, administrators, at a time when we were building new buildings and our population had started to go up. I was on the original committee that formed the Ronald McDonald House at KU Mid-Center. I also know what it's like to be a business owner. I actually owned a bookkeeping company in my earlier years, and also dealt with payrolls, budgets, and a number of things for tax auditors and payrolls in 7 different states. We have several challenges facing our state, and the upcoming session is going to be very, very interesting, I think, to say the least. I look forward to working with the governor and all legislators to provide the safest environment during this pandemic, and with our businesses to open doors and get people back to work. I look forward to the questions, and let's get started.
Great, thank you, ladies. Let's move into our moderated question and answers. Just to remind each of you, you'll get 1.5 minutes to respond, and we're going to rotate your speaking order. So with question 1, Cindy, I'm going to start with you. What do you see as the top 3 business policy issues facing the state of Kansas in the coming year?
As I said, this is going to be a very challenging time as we are still facing the pandemic, coming back, jobs, businesses. I think my first one is broadband. When we talk about revitalizing and building businesses in Kansas, we have to have the capability to have broadband in all communities. As we are tasked today with virtual learning for schools, many of our school districts out west do not have the ability to have broadband, and so that puts our kids at risk. My second one is infrastructure, which are roads and bridges. We're very lucky that we have a very energetic transportation secretary and the Ike 10-year program. Third, economic development, that we can continue to bring businesses and stuff to Kansas. And if we approach that later as a question, I do have some statistics that will be, I think, impressive as we visit. Thank you so much.
Thank you, Cindy. Okay, Cathy, it's your turn. What do you see as the top 3 business policy issues facing the state of Kansas?
This is something we could probably have a conversation on for hours and hours. But I'm going to start with value-based healthcare. The healthcare question that we all have, and especially in lieu of the pandemic, is what can I get for the most that I can offer? And value-based healthcare basically means, Are we getting what we expect to get with the money we're paying? And I would start with that as a priority, and especially with the pandemic. There are a lot of loopholes. There are a lot of questions that a lot of people are still wanting to answer on how can I get the best out of my healthcare dollars. The second thing is our schools. God bless every teacher out there and every student and every mom and dad. Our schools are facing a crisis right now. I have met many, many people that either did not enroll their children in school, or the children are home alone because mom and dad are both working, or they're a single parent home. I am very concerned about the education of our students in the future. So that's a big priority right now. And the third one is getting the economy back open, getting people back open, helping these small businesses that are suffering, getting incomes back into the pocketbooks of our citizens. So those are my top three. And I'll just say it again: the healthcare, value-based healthcare, the school concerns with the pandemic, and getting the economy back open.
Thank you, Cathy. All right, we're going to stick with you for question 2.
Okay.
How would you propose to balance the state budget? What specific budget cuts would you support, and what revenue enhancements would you consider, if any?
Oh boy, Natalie, that's a great question. Balancing the budget is not going to be an easy one. We've been circling it for years over how to balance the Kansas budget. And one of the things I think we need to do is ask our voters, ask our citizens, how do they want to see it? Before we do anything with taxes, increasing taxes to help bring in revenue, we have to ask the voters. We can't just consider balancing the budget by increasing taxes or bringing in, especially property taxes. My heart goes out to business owners, especially with the pandemic and the crisis they've endured, in making changes so that they can take care of their constituents. I'll say the people that come into their businesses. It's been costly. It's been hard on payroll. If someone is assumed infected with COVID, they are quarantined, so they've lost the revenue of having another staff member, but still paying for them to be out. It's a big circle. So balancing the budget is not going to be an easy one for us to tackle. It'll be a daily, one thing at a time. And I think looking at the healthcare, that's again why I talked about value-based healthcare. Instead of just throwing money and bringing on new ideas, we need to figure out how we can get the most bang for every dollar that we spend in our state. So that's a very brief, but I could, again, spend a whole hour on this one topic. Thank you.
All right, thanks, Cathy. Cindy, it's your turn. How would you propose to balance the state budget? What specific budget cuts would you support, and what revenue enhancements would you consider, if any?
I think we're going to have to go back and look at where we are as a state after we get the revenues in this month. Last month, they came in at 30.5 million above expectation. And that was a good thing since we are in the pandemic and we have spent a lot of funding on the pandemic. I think we have to be able to work together in compromise and across party lines, because this is going to be that difficult time. We have issues with telemedicine. We want to make sure that that is accessible. As far as budget enhancements are concerned, what we could do is look at bedding. I know we had some bills on the floor last year looking at that. It would be a tough time to raise taxes. I don't think anybody wants to raise taxes, and we have to be very, very mindful of how many people are out of work, don't have a job, and how we can best provide them opportunities to obtain quality jobs as we open up in the pandemic. That would be the revenue enhancement. As far as budget cuts, we are held to the courts. And they're settling for education. So I think there are different parts of the budget that we're going to have to deal with more than we've had to in the past.
Thanks, Cindy. We're going to stay with you for the next one. And it leads into, what would you do to grow and develop the state's workforce?
Well, I am happy with some of the things that have been occurring, and I think there are ways to continue to do that. Over the past 2 years, Shawnee has created approximately 1,800 new jobs. I think that's fantastic. In the state of Kansas during that same period, the state of Kansas had 157 economic development projects worth over 2.8 billion in capital investment. And that translated into 16,148 new jobs. That door is open. It is opening more every day. And I think that comes from the fact that we have a new Commerce Secretary who is devoted to increasing workplaces and jobs in the state of Kansas. And we have seen that here in Shawnee as we work together in partnerships to create projects.
I'll jump in. I do think we lost Natalie there. I would imagine she'll probably hop in just a second. And luckily, I've got the timer here, so I can honestly keep us going on the next question. Cathy, that question was, what would you do to grow and develop the state's workforce? If you'd like to answer that in the meantime.
Sure. Thanks so much. Getting our businesses back open is the priority, of course. And we all agree with that. We need to get back into the business of growing our state without the pandemic. And however that can happen with each individual businesses, I think that they have the power and quality and the mindset to do that on their own. And I look forward to being able to go to the restaurants again and having a great hamburger or some good Kansas City barbecue without the concerns of the pandemic. Expanding our labor forces, I'm a big supporter of the apprenticeship programs such as iron workers and pipe fitters. My own family are part of that, and I support that, and I would encourage us to empower more of these programs. Our nation was built on laborers, and our Kansans know how to do this well. So I would encourage our labor force and limit the liabilities associated with that. And then I'd also promote the innovation and entrepreneurship with creative ideas of capital investments. And we are known for doing that. We can empower that even more. One small example is just opening our state up to great ideas. For example, nurse practitioners are beginning to join the compact, which makes it where nurses can come from other states and actually they'll be recruited to the critical access areas, which is a great thing for our Kansas healthcare workforce. So with that said, I'll end. My time is up, but thank you.
Okay, Dustin, I'm jumping on to take over for Natalie if you want me to, so you can do the timing and
Great.
pick up where we were at. This is, I believe we just covered the one about economic development. I'll ask you a question. I believe the first person to answer this will be Cathy. What would you do to, or can you share with us your views on the K through 12 funding?
Well, we are facing the pandemic, and so the K through 12 funding is a great question, and yet to be foreseen in the future on how we best answer that. Again, the teachers and the students and the parents are all at a mixed time. Getting access education to our children is a primary, and I've witnessed myself through the campaigning, people knocking on doors and only children are at home doing their online lessons. So I'm quite concerned about their education. I would like to know how many kids are actually enrolled in the education process right now. I think that we're going to be looking hardly at it in a different way, a new way. So answering the Kansas K through 12 funding right now, we don't know. I have a feeling that they're going to need more help with things like fiber optic cables to get that broadband out, as Cindy had mentioned, but at the same time, we're lacking quality education. I don't think that there's enough children enrolled in school. I'm seeing it personally, and I'm greatly concerned. So funding is yet to be answered as we move forward and open our economy, and most importantly, get our kids back in school.
Okay, thank you. Cindy, can you share with us your views on K through 12 funding, please?
Well, this is something that's near and dear to my heart. I've spent most of my time in the legislature working toward financial funding, appropriate financial funding for K through 12 education. We have been in court for years, and we are finally out of court, but the court does hold our feet to the fire and have maintained holding that while resolving the constitutional process of the finance, school finance. What we're going to have to do is continue to do that, but in a bigger part, we have got to allow for PPE and funding for those kids that are in school and those parents that opt to have them at home. I think every school district is functioning a little bit different. They're trying different models. I know I have a grandson in Mill Valley, and 2 days are on virtual and the rest is in class. And that is one model. Some parents want their kids in school full time, but then we have the issue of expanding COVID through teachers and staff. And kids get COVID and the teachers are going to get COVID. And we have to be very mindful on be able to provide them the equipment they need to have safety in the classroom.
Okay, thank you. Question number 5. We'll stay with you, Cindy. What type of economic development policies will you support to encourage job growth and business expansion in Kansas?
Well, I think one of the things that we can do is, and I know Shawnee has done this, they have provided grants to businesses and places in the city. And we've seen that through our new Neiman Now, which is open, and the enhancements that has provided. The state also has grants that are open through the Chamber of Commerce to help businesses expand and bring new businesses in. And I noticed on some articles this morning that we've been very lucky that our Chamber of Commerce is working with our cities in partnerships, and that money is going to be able to go farther and be spent on projects that are in real time. And so do what's right for the committee, for the community, as well as providing the new jobs and opportunities for businesses to start up.
Okay, Cathy, what type of economic development policies will you support to encourage job growth and business expansion in Kansas?
I am very open to the innovative ideas of economic development, especially when it calls for our best commodity, our citizens, and getting access to healthcare in the rural critical areas is a priority. Getting value-based healthcare is a priority. So bringing on those innovative ideas in Kansas and attracting healthcare providers in the frontier areas is a key idea of the development for the economics of saving communities. When you close a community hospital, you lose the community. People drive 60 miles to go to a larger city, their community starts to die. Their football team goes down, their school goes down. And so I'm a big promoter of the frontier areas of Kansas and promoting value-based healthcare in those frontiers, as well as the education, the value-based education. Every dollar that we put into education, we want to see the quality coming out of our children, and the test scores are improving, and college-bound kids are getting to college if they choose to, or getting into an apprenticeship program where they can learn a skill and work as an effective, sustainable citizen in our state. So I'm 100% in favor of economic development and the innovative ideas to promote our citizens in our state. Thank you.
Thank you, Cathy. And see that Natalie has now rejoined us. So to bring her back, we have a little glitch there that we got through. Natalie, we're at question 6, so I'll ask that. It's for Cathy first, and then you can take it up with Cindy and from there and then close it out. So question number 6, Cathy, is what are your views on healthcare policy and Medicaid expansion in Kansas?
I've had the opportunity to serve in over 40 countries as a medical missionary throughout my career. And in those countries, I have witnessed all kinds of healthcare, especially government-run healthcare. And it is not the finest, and I don't think it's what we want as Americans. I am very focused on value-based healthcare and outcomes. So if we take a program and we truly look at it and say, are we getting the best preventative outcomes that we can and saving money, I'm 100% behind it. There are a lot of solutions to reducing the cost of Medicaid, for example, that have not been implemented in our state. The state spent a large amount of money, I'll say $3 million on the Alvarez-Marcel report in 2016. And a lot of those healthcare-based ideas have not been implemented to save money in our Medicaid CanCare programs alone. So again, these are value-based healthcare initiatives that I would be very interested in opening the door to and promoting. Kansas needs more healthcare providers in the frontier. We need to have access to them. We need to have recruitment of them. And one of the ways to do that is to remove the restrictions on the APRN's licensure. And so that is a very passionate area that I will move forward on. I know that Cindy, I think you've been involved in it in the past, but if we can reduce the restrictions of their licensure with a collaborative practice agreement, we will have more providers in Kansas. Thanks.
Okay, Cindy, it's your turn.
Thank you. Thank you.
What are your views on healthcare policy and Medicaid expansion in Kansas?
Well, I think it's very important that we take Medicaid expansion back up. And I know that Cathy does not support Medicaid expansion. But the issue here is we have 150,000 Kansans that are uninsured. The bill that was designed by Senator Denning and worked through with our governor actually had some stopgaps in there that would not put us in more debt. In fact, it would be revenue neutral. And those were, there would be a copay on charged to each of the patients. And then also, if the program quit from the federal level, our plan would also quit. So that caveat in there does not keep Kansas tied to providing all of that funding. My daughter's an OBGYN and she trains midwives and has. And in speaking with her, I think the problem I have is that first, we have to have broadband in rural areas. No hospital, no other business, nothing is going to come to a rural area if they don't have access to broadband for their students as far as being in school, for their medical communities. And Cathy was right. Hospitals are closing. I think we've had 5, maybe 7 across the state to this date. And that is critical to any community that we go in. I want to thank you for the opportunity to share those statistics, and my time is up. And I could spend hours talking on that too.
Well, thank you, Cindy. Okay, we're going to go to question 7, and it's going to stay with you. What are your views on state tax policy?
Starting with me?
Yeah.
Okay. Our original tax policy was based on a 3-legged stool. During the Brownback era and experiment, it went down to 2 with the inability to replace revenues. And that tax credit or that tax given back to LLCs, most of those LLCs were saying, we don't want this the way it is done. We need to be a player in the system. I want to make sure that we keep that 3-legged stool and then we don't go back to experimenting. And that is income, state, and property tax. I have no desire to raise any taxes at this point. And I think our governor has come and said she really doesn't want to raise taxes during this pandemic time. It's difficult for all people across the state of Kansas, and we need to keep a fair tax code, a fair tax policy. The one thing I would like to see, but we don't have the revenue to replace it, is a reduction on food sales tax, because we're the highest in the nation. But that comes at a cost, and unless we have a replacement for it during this time, it would be hard to look at that. So thank you very much.
All right, thanks. Cathy, what are your views on state tax policy?
Wow, state taxes are, depending on who you ask, you'll get different answers, that's for sure. Regarding the small businesses, they're taxed like crazy. They're taxed on their property, they're taxed on payroll, they're taxed on workman's comp, they're taxed right and left. And however we can reduce the tax on small businesses and help them be successful, that's the key to Kansas. We have so many entrepreneurs throughout our state, including farmers. We need to help reduce their burden so that they can keep the jobs going for people. I'm also a big fan of reducing the food tax. Thank you, Cindy, for saying that. It's embarrassing that we have such a high food tax. There are ways to overcome that. We can just flip it, like some other states, for example, there's tax on carbonated sugary beverages like sodas, soda pop. Increasing the tax on alcohol, cigarettes, what we call the sin behaviors. Those kind of things can actually help relieve the burden of the food tax. People need access to food. If they can't eat, they can't learn in school. If they can't eat, they can't sleep well at night, and then their body falls apart and they're not healthy. So it's a paradigm shift that we need to do. I would like to say, before we do any tax changes, especially increasing, we need to ask the voters, is that what you want? And that's the best way to answer the question on increasing taxes as we move out of the pandemic. Get the jobs back open. Thanks so much.
Okay, Cathy and Cindy, we're at our last question. What do you believe most distinguishes you from your opponent in this race? Cathy, we'll let you answer that.
Cindy and I both have a little bit of healthcare knowledge. I will say that. I am quite the independent. I've been called abnormal in many ways. What I mean by that is I'm a nurse practitioner that owns her own business. I'm a nurse practitioner that started a nonprofit, over 20 years ago, and it's still very successful. I have a proven model of putting my blinders on and moving forward in a passionate way for value-based healthcare and value-based outcomes. And I think that as we move forward in our state, especially with the pandemic, the biggest thing that I am passionate about is informed consent. And that's making sure every voter has the information they need, every citizen, to make a decision. And that could be as simple as, do I need to wear a mask in my house? Or can I step outside and walk my dog without a mask on or not? Being a responsible citizen and getting the right information. So I have a tendency to be a little bit more of a research nerd. I love numbers, I love statistics, and I love to look at what do I get the most money for every dollar that I spend. That's the passion that I started with in the nonprofit world that kept Mercy and Truth Medical Mission sustainable for over 20 years and still going strong today as a nurse practitioner based healthcare clinic model. So just in a little bit, that's totally makes me different than my opponent. We both are educated women. We're both very strong and passionate and love our best commodity, our state of Kansas and the citizens in it. So thank you so much. And I look forward to chatting with you some more, all of you. Thank you, Chamber.
Great. Thanks, Cathy. All right, Cindy, your thoughts on what do you believe most distinguishes you from your opponent in this race?
I could say been there, done that, but I have served in the legislature for over 10 years now. And I find that the greatest gift any legislator can have is listening, because that's where we have compromise. That's where we gain the most out of any kind of bills or laws that we pass. having the knowledge of how the system works. Rome wasn't built in a day, and I can guarantee you a bill was not born in a day. And I had one bill that I followed all the way through and got it done my first year. But a lot of times it's 6 or 7 or 8 years before your goal or your passion gets recognized, because it takes compromise. It brings people's thoughts together. It makes people sit down and listen to get to the best level of any kind of bill that is passed. What I would like to do is ask for the voters to vote on November 3rd, but please, only once. And I think that's important. And but serving on these committees, I have a background in history in a lot of the areas that are going to be called for during this next session. Thank you very much, and thank you to the chamber.
Well, thank you, both of you. Thank you for your patience with me. I'm sure I have a guarantee that I won't be asked back as a moderator, but
I think you should.
Between my allergies and my internet, I seem to have not been very successful, but we are not done. You each do get 2 minutes to wrap up any final comments that you would like. And if you want, Cathy, we'll start with you to do the wrap up, and then Cindy, you'll go second.
Okay, sure. My final thoughts are, I have been passionately listening to a lot of our citizens here in Shawnee, and I am hearing you, and I will take that all the way to the State House. I too have served on a city council before, and did make big changes in the critical access area that I lived in by bringing 911 to the area, and I will do the same here for you. I have a deep heart love of the people of Kansas. I love our state. I love what it stands for, and I want to make it even a better state, get more people to our state. We have one of the best kept secrets in the entire United States, and it's called family. It's called being neighbors. It's called, we can walk across the street and know that our neighbors have an open door policy, and let's keep our state like that. Let's keep us the neighborly one to share a cup of sugar, or to pull in somebody's trash cans, or maybe go and help them cut their wheat fields or round up their cattle. That's what Kansas is all about. And I want to keep it that way. I am very strong, very passionate about keeping our state exactly what it is, and attracting more families to love on this wonderful, wonderful attitude and love that we have in our state. So I look forward to working with everyone in the future and promoting our state as one of the best places to raise a family.
Thank you, Cathy.
Yeah.
Okay, Cindy, it's your opportunity. Please, any closing statements that you have for us? Thanks.
Thank you very much. I am also passionate in a lot of areas. One of the concerns I have right now that's very large is the mental health community. What COVID has done in reference to mental health. We've got more suicides. We've got more people who are in trouble. They haven't been out. They haven't been about, and being locked in their house or feeling like they're locked in their house has been very difficult. Education is a passion of mine, having spent over 34 years in that. I also served as president of the Kansas Association of School Boards. I've traveled around the state, but I've also traveled nationally for education. And one of the things we learned in conventions that I've been to is we looked at what is education going to look like in the future. And oddly enough, people were talking about virtual learning. Would we be in the classroom? Unfortunately, it was brought to us before we had time to plan it and to work out the bugs. And right now we have a lot of bugs. I would like to get kids back in the classroom. I want to get people back to work, but the priority is safety. It is protection. It is to make sure that when people go out, whether it be to a restaurant, into a building, into a concert or anything like that, that they feel that they are safe and protected. And the biggest issue, again, I would go back and say, is broadband. Without it, our hospitals don't function, our students can't function, our businesses that want to relocate can't function because that is not there. We have to work as a state, both with the federal government and locally, to provide that funding for all. Thank you. And again, I ask for your vote on November the 3rd.
Great. Well, thank you, Cathy. Thank you, Cindy. We appreciate you participating with us. This does conclude today's forum for Kansas House District 18. Thank you for taking the time to be with us. And once again, thank you to our sponsor, Evergy. Today's forum will be available to view along with all the other races in Johnson County on the JCPPC website at votejoco.com. Many of the candidates have also completed surveys that they can be found there as well. So let me close with just a few reminders on some key dates. Advanced voting begins by mail on October 14th. You may return your ballot in Shawnee at the drop box located at Shawnee Library, 13811 Johnson Drive, or via the U.S. mail. Advanced voting in person begins on Saturday, October 17th, and you can cast your ballot in Shawnee at the Oaken Fieldhouse, 2200 Johnson Drive. General Election Day is Tuesday, November 3rd, and polls will be open from 6 a.m. to 7 p.m. So again, please vote. And thank you so much, all of you, for joining us today and for your patience. Have a great afternoon.
Thank you.
Thanks so much.
Thank you so much. See ya.